The first death has been confirmed in the worsening Texas measles outbreak. HHS Secretary Robert F. Kennedy Jr. says that his department is keeping an eye on it.
Incidentally, there have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
RFK Jr. added that they are doing a daily follow-up on the epidemic. More than 120 cases have already been reported in Texas, as well as several in New Mexico. And for more, let's bring in Dr. Dana Hawkinson, Medical Director of Infectious Prevention and Control with the University of Kansas Health System. Dr. Hawkinson, great to be with you. So how concerning is this current measles outbreak, especially now that it's being reported that an unvaccinated child in West Texas died after contracting measles, the first death due to the virus since 2015?
Yeah, for the nation, I think it's concerning. For that community, I think it is extremely concerning when you also understand the low rates of vaccination from their evidence of their kindergarten data. It is very concerning. Typically, we see a death for every 1,000 cases of measles. Unfortunately, there are about 124 cases now that have been identified, and we've already had our first pediatric death. Obviously, any death and any is a tragedy, so it is very concerning, especially as there is no current end in sight for people that have been exposed and the number of diagnosed cases at this point in time.
Yeah, and 25 years ago, back in 2000, measles was declared eliminated here in the United States. So why are we seeing this resurgence in the potentially deadly virus?
Yeah, I think this is certainly multifactorial. I think number one, we did have a pandemic. During that time, there was less access to care. There were less people seeking care for emergency purposes, but also for routine care. I think that has carried over. Also, we know that there are increased rates of exemption for different vaccines, especially for those typically mandated or childhood preventable diseases vaccines, such as measles, mumps, rubella. I think there's also a distrust of the medical community, the scientific community, the public health community. In addition, most people have never seen measles. Most physicians have never seen measles in the United States. We have forgotten what measles is like. In addition, we've forgotten the memory of measles. And so I think it is multifactorial, and all those things are playing a role.
Yeah, doctor, then talk to us about some of the symptoms and what should people be looking out for when it comes to measles?
Yeah, I mean, it is hard. There are some prodromal symptoms like a typical respiratory infection. Unfortunately, after that, you start to develop a rash, a characteristic measles rash, which you showed a picture of. And from there, it develops on the head and moves down to the body. And that is going to be basically the manifestation of the disease. Now, unfortunately, complications of that are varying as well. We know that about 1 in 5 people are hospitalized. We know that about 1 in 20 can get a pneumonia, a secondary pneumonia from this disease as well. And then, as I stated before, typically 1 in 1,000 cases can die. And then you can even have central nervous system effects, which affects the brain and the spinal cord, and that can be 1 to 3 people for every 1,000 cases as well. So it is not a benign disease. As you see more cases, you will see more of those complications occur.
All right, we don't want to scare folks, though. So,
No.
doctor, tell us the best way to protect themselves.
Yeah, I think you're exactly right. There is no need to scare people. We have a safe, an effective vaccine that has been used for many decades. The best way to protect yourself is get yourself vaccinated or be up to date with vaccination. We know that we can develop individual immunity by vaccination, but also develop herd immunity in the community, and so that we can help decrease the spread, especially to those people that may be more at high risk of severe disease, like the elderly, those with chronic conditions, as well as those who are immunocompromised. So I think the best method of prevention is continuing to vaccinate.
Oh, Dr. Hawkinson, thank you so much. We appreciate it. God bless you.
Thank you.